Hi, welcome to the Stalking Horse channel. This is Stacy here. We've had a lot of requests and seen a lot of questions about people getting into the field, into medical coding, and asking what the job is like, what day-to-day is like, and what the difference is between going to school and then like when you actually get into the career, what you can expect those changes to be. So if you are either new to the profession or currently in school or debating on whether to go to school for coding, this video is for you. So stay tuned because we're gonna go into the good, the bad, and the ugly about being a medical coder. Welcome back. So we're going to talk about becoming a medical coder, what that's like, and the day-to-day functions. And so if you're new to medical coding or if you're interested in getting into it, this video is for you. So I actually became a coder many moons ago, back when you took the exam and everything was on paper and you had to wait weeks and weeks for your results. And the trick about knowing if you passed or not was you would get that envelope in the mail, and if you passed, you would see the certification behind your name. So similar now that when you log in to whatever your site is that for your certification, whether it be AAPC or AHIMA, that you should see a credential then behind your name if you've passed. So anyhow, with that being said, many people get medical coding confused with like computer and software coding. So obviously this is completely different. So in medical coding, we are actually taking the documentation and what's stated within that documentation, that language, and translating it into numbers, into codes, to be submitted out normally to insurance companies for payment, but that information is also used by the World Health Organization, the CDC. It's all data collection and helps to prevent or prepare us for things like this COVID-19 pandemic. So if you've watched the news, you kind of know that they're getting all this data and gathering it together about the number of people infected, the number of people hospitalized, and they obtain all that data through coding. So really that's what medical coding is. It's taking that clinical language, translating it into a code, and then submitting it out, and that information is used for multiple things, not just payment, but that is one of the big ones. Obviously, if you work in the profession, you need to get paid, and so that needs to happen. So with that being said, when you go to school for medical coding, whether you do an online course or you attend a college or you attend a career institute, you kind of learn from the book. You learn about basics, you learn about guidelines, and that's all very well and good, and I think does most of the time help you prepare immensely for sitting for a certification or an examination. But it is super difficult to get a job in medical coding without a certification. In fact, I don't really know if anybody hires anymore at all for a medical coding job without a certification. I know even years ago when I took it, no, I'm not going to tell you when, but years ago when I took it, it was kind of one of those things that not everyone was certified, but it was starting to really go to that point where it was more and more difficult to get a job in coding if you weren't certified. So the actual certification cannot be underestimated or undervalued, because even if you have years of education through college, if you don't have that certification, the likelihood of you getting a coding job is slim to none. So certification is important, and getting that baseline of education is helpful and helping you to learn how to use your tools and effectively make it through the examination. And the examination is all about using your resources. So do you know how to effectively use this book as well as a few others? Do you know how to interpret it? Do you know how to look through the guidelines and how to answer questions? And all of that is done with a time limit as well. So really that's where your examination is. However, the difference between actually doing that on an exam and then when you get into a position, it's different. So here at Stalking Horse, we've actually taken on externs in the past, something that we often do, and help them to learn about the differences and when you get that first piece of live documentation in front of you that you're looking at to code, it's just a different feeling overall. It's no longer a test, it's no longer a question, it's just different. And things aren't as structured when you look at a physician's note in real life, in real coding, than it is when you're doing an exam or you're looking at something from a book. When they're trying to teach you about the points from a book or in a class, they're kind of giving you some clean, fine examples of what those points are that they're trying to teach you. When you get into everyday coding, you're going to see things that are really going to make you scratch your head and wonder, how does this work? How does this translate? Maybe you thought you knew specificity really well in ICD-10 coding, but once you really dig into those notes and you get started, it can really be a challenge. The key is to not give up, to believe in yourself and keep pushing through, because there are going to be times where you're going to want to pull your hair out because certain concepts can be frustrating, especially when you're getting into the job. Most jobs have different standards for quality and also for productivity that you're going to need to meet. And so you need to maintain high quality while maintaining a certain level of productivity. And that can be very difficult when you're first starting out. So just remember that everybody had to start somewhere, that with perseverance and, continuing to work through it, you can get through those snafus, those problems. Keep believing in yourself and keep working at it. Really, that's the key. And that's something that we here at Stalking Horse look for in someone. So if we're going to keep on an extern, it's going to be that person that keeps pushing through, keeps making improvements, is constantly wanting to improve, is asking questions. So that's one of the biggest things too. No one knows everything. I don't know everything. So the key is, knowing that you don't know everything. And when you don't know, feeling like you can ask. So reaching out to someone within your group, someone that you know, even posting a comment here on this topic with a question, just asking, networking with fellow coders, getting to know those, going to chapter meetings and different things where you can network together so that when you have questions, challenges, you can bounce things off of each other. That can't be understated. So typical day of a coder is you're going to go in, you're going to sit down, you're going to take a look at documentation, you're going to do a ton of reading, and you're going to be opening books, and you're going to be looking at online resources as well. So if you like to research, if you like to read, if you like to stay focused, if you like to solve puzzles, then this might be the right career for you. So I hope you found this helpful. Don't forget to go ahead and place some comments down if you have any questions or any requests for future topics. Don't forget to like and subscribe to our page to make sure that you get the updates every week. And don't forget, you heard it straight from the horse's mouth.